Good afternoon. Today we will be discussing the new initiative here at Monroe Regional Medical Center called the No Pass Zone. Our objectives today will be to identify how patients tell us that they need our help. We're going to talk about what we can do to improve our responsiveness. We'll also discuss how to appropriately respond to call lights on patients that are not assigned to you. And finally, we'll discuss words that work to help improve perception of our patients. So let's begin by discussing responsiveness. How do we show our patients that we are trying to be responsive to their needs? In addition to answering the call light, there are other things that we can do to show this. The first is the 5-foot rule. Anyone within 5 feet of you, you should acknowledge and greet. Wayfinding. Have you ever been walking down the hallway and see someone that doesn't quite know where they're going? Take the time, stop, take them to their destination. Don't point in the directions that they may potentially become lost again. Elevator etiquette. When you're on the elevator, make conversation with those that are around you. So how do our patients communicate to us that they need our help? Again, they use their call light. That's probably the top way that they communicate to us, but there are many other ways that they can do that. There's nonverbal cues. They can look at the nurse or the staff as they are passing their room. They can try to wave you down, stand in the doorway and watch you, or they can call out. Some of our confused patients may actually scream. So how here at Monroe are our patients perceiving our responsiveness? Well, as you can see here, this graph depicts quarter 1 in blue, quarter 2 in red, and quarter 3 in green. And our individual questions that reflect our responsiveness are, number 1, after you press the call button, how often did you get help as soon as you wanted it? As you can see in quarter 3, we are currently at 47.2%. This is the percentage of patients that respond always did they get the help as soon as they wanted it after they pressed the call light. The second question, how often did you get help going to the bathroom as soon as you wanted it? 57% in quarter 3 responded that we always got help in getting to the bathroom as soon as they wanted it. This is certainly not where we want to be. We want to increase this to a higher percentage of always. So who do you think can impact patient perception? Certainly everybody can. This is going to be a team effort. This takes the help of clinical staff and non-clinical staff. Think of the people that walk past a doorway or a call light that's going off. That's going to be dietary, physical therapy, lab, speech, physicians, nurses, and many, many more. So let me introduce you to the No Pass Zone initiative, which we are going to be implementing here at Monroe Regional Medical Center. This is for both clinical and non-clinical staff. Let's discuss if you're going into a room of a patient that's not directly assigned to you. The call light goes on, you knock on the door before entering, and hand sanitize. You're going to use AID-IT, acknowledge the patient, and introduce yourself. Make sure they know who you are because they're not familiar with you. Ask yourself, can I address what their need is? If yes, complete the task. Perhaps it's getting tissues or maybe pulling their glasses closer to them. If no, use words that work and find assistance for the patient. Words that work are things like, let me get you the nurse, for your safety to help you to the bathroom. Or, for your privacy, I'm going to ask the patient care tech to come in and help you with your bath. Once you leave the room to find assistance, make sure that you return to the room to close the loop with the patient. Explain to the patient who you talked to, and try to give them the duration of how long it will be until someone can come and provide the service that they're requesting. Explain to them who you've talked to and thank them for their patience. Before leaving the room, you should also conduct an environmental safety assessment, making sure they have everything within reach and that they are in a safe condition before leaving the room. This concludes our conversations about the no-pass zone. If you should have any questions, I look forward to having discussions with you on Adobe Connect on December 10th. Thank you for your time.